Hi, I'm Dr. Brian Pokorski, and in the spirit of Halloween, I'd like to share with you some of the anatomy of the upper cervical spine with some real bones and show you one of the scariest misalignments that I've ever seen. At the very top of your neck, there's a bone called the atlas, or C1. As you can see here, it's ring-shaped, and that shape is different than any of the other bones in your spine. And on one hand, that's really good because it allows for all the wonderful range of motion that we have in our necks. We can turn and tip, flex our head and necks down and back so we can see what's happening all around us. Now, on the other hand, all of that mobility leaves this area of the spine very susceptible to injury. And as you can see here with the rest of the spine, all of these joints lock these vertebrae together and don't allow for that excessive movement, okay? So here's why that's important. Your brain sits up here, extends down through the opening at the base of the skull, right through here, passes through the center of C1, and then later continues on to become the spinal cord. If that area is injured, this bone can shift out of its normal alignment and cause irritation to the sensitive nerve tissue that passes through it. It's that misalignment or subluxation that alters the messages from the brain to the body and from the body back to the brain, which can cause all sorts of health challenges. It can also alter blood flow to and from the brain as well. And it can disrupt movement of cerebrospinal fluid, which bathes and nourishes and cleans out the brain, just like you can see here in the poster. Now, let's look at a real patient who presented with shoulder and neck pain that was so bad they could no longer work. In addition, they struggle with anxiety, bowel problems, poor circulation, and even headaches. They tried all sorts of different treatments before discovering the cause of their problem. So let's take a look. This is our patient facing forward. We're going to turn this patient all the way around so we're looking at them from behind. Now, I'm not sure if you can tell, but certainly this spine is not straight. All right, and that top bone, you can even tell is tipped or twisted away. I'm going to turn this patient around again and we're going to show you the extent of that misalignment. We're going to tip them all the way back. Very good. Bring them back over here. All right, so now let's take away some of that structure. Good, okay. Now, this is that top vertebra in this patient's neck. If we were to simply compare on the right and left sides how close the transverse processes or the wings of that top bone are in relation to the jaw, you can certainly see that this one's much closer than this opposite side. That bone is literally torqued and twisted forward on the left in this particular case. As I mentioned earlier, this patient had neck pain and shoulder pain that prevented them from working. They had a bunch of different health issues. And it's my belief that this may be the cause of what's creating some of those situations for them. As we start to correct this, my expectation is that they start to improve their health, get back to work, and get back to living the life that they deserve. So if you or someone that you know is struggling with health challenges, it may be this misalignment that's really at the root cause of it. You can certainly click on the link below or call the office. We'd be happy to see you and find out if this is contributing to your poor health and if the restoration of it, of its natural position, is going to get you back on your feet and getting you to the quality of life that you deserve. Thank you very much and have a happy Halloween.